I'm very pleased to welcome ApostolosTsapas to the studio. Apostolos, you come from Greece, you're a diabetologist that's interested particularly in evidence synthesis, and this EASD 18 is going to be a very important one for you. Where's that?
Absolutely. So in this EASD meeting on Friday, the new consensus report issued by ADA EASD is going to be presented. The draft version was presented some months ago in June in US, and based on feedback we got from colleagues and from associations across the globe, we have revised and we are presenting a final version of this consensus report on Friday. But apart from that, during this meeting, several cardiovascular outcome trials are going to present their results, including Harmony and Carmelina, so from various categories, but also cardiovascular outcome trials from novel agents that have been presented during the last months, like semaglutide.
So there's a lot to go in here. Just tell me a bit more about the guidelines. How important are the guidelines? How long are they expected to last for? I mean, is this going to set the direction for the next 2 or 3 years or for a longer period?
So for the last 9 years, there was an iteration which was being presented every 3 years. So in the 2012, 2015, and this is the 2018 iteration. There is no steady life cycle, but on the other hand, we're used to hearing from these two associations issuing a joint report every 3 years. It's quite influential because it's being listened to by people from both sides of the Atlantic, and people are looking forward to that. And on the other hand, there has been quite a lot of news during the last years from cardiovascular outcome trials, which might have an effect on these consensus reports.
And how different are the consensus reports today compared with, say, 10 years ago? How has practice changed?
Absolutely different. So in a sense that today we have a lot of novel agents that were not available some 10 years ago. And on the other hand, we also have quite a lot of data from randomized clinical trials, which are changing our way of practicing medicine and of treating our patients. So in that sense, it's very different.
And actually, it seems to be ever more complex in some ways. I mean, for the ordinary diabetologist in a general hospital anywhere in Europe, with more and more agents coming on stream, it's very hard to make sense of all of this. Do you think the guidelines will be something that will really be, a guiding light to people in those situations?
Of course, the more agents you get, the more challenging it might be to make a choice. But this is what we're looking for then, for evidence from randomized trials, to get hard data to see what's the best to choose. And in that sense, people are expecting from the guidelines or from consensus report to get some guidance on what they should do. Another, of course, important thing which was introduced in the previous iterations and is probably also an important part in this iteration as well is that they were patient-centered. So the patient is a part of the decision-making process. So it's not just the clinician who is making a decision, but always in cooperation with the patient.
Terrific. So I just want to finish by asking you, what is apart from the guidelines, what is the not miss session for you? What's the one that you absolutely have to go to?
So I would not miss the sessions which are for the new CVOTs, the new cardiovascular outcome trials. Pioneer, Harmony and Carmelina, I would probably not miss these sessions. And the UKBDS session, I think that's an important session as well. It's a trial which is there for almost 40 years now, the results we're getting from that trial, and I think it's very important.
Okay, well, you had it from the expert there. Those are the sessions not to miss. And in case you aren't at the conference or want to pick up something that you haven't been able to go to because the sessions have clashed, you can see all of this through EASD.org.